Today we will discuss regarding prevention of urinary tract infection in summer. In summer, it is very difficult to take out the extra heat load from our body to environment. So, when the temperature of atmosphere exceeds our body temperature, it is very difficult to lose heat from our inner core of our body to atmosphere, because it needs a lot of complex mechanism. So in order to keep our body cool and maintain the core temperature at 37 degrees centigrade, lot of sweatings is required. Our body generates sweats and got it evaporated to atmosphere, and as a result of that it loses its core temperature and maintain it at 37 degree centigrade. So in this process there is a lot of loss of water from our body. So in order to maintain a healthy urinary output of 1500 ml per day, our body faces a constant challenge of maintaining its water input to our system, so that our excretory organs can able to discharge and expel the waste product of our body arising out of metabolism. So in summer there is excess water demand for our body, so that sweating can comfortably take place and our body temperature can be controlled. So thirst is an unreliable indicator of our water requirement inside our body. When we feel thirst and thirsty, then it is too late for our body to fulfill its water demand. So before that, our dehydration status is reflected in urine color. Whenever there is a change in our natural color of urine, there is a water demand inside our body. So when we are unable to judge it from the urine color and quantity of urination, our urinary tract gets concentrated urine to be discharged throughout its urinary tract. So the entire urinary tract, it starts from kidney, the nephrons, the proximal convoluted tubules, the calyx, and the ureter, bladder, urethra, and the entire passage of urine becomes very painful. In the condition of passage of concentrated and acidic urine leads to stasis and inadequate flows of natural organism, and some organism gets pathogenic in this process. So most common organism is Escherichia coli. So E. coli related urinary tract infection is very common, particularly in case of female and in case of aged persons due to urinary stasis. People who are suffering from benign prostatic hypertrophy and some renal stone related diseases often gets more frequent attack of urinary tract infection. So what are the symptoms? The main symptoms of urinary tract infection is fever with rigor and chill, burning sensation of urination, and painful passage of urine, dark concentrated urine, and in the advanced stage of urinary tract infection, blood may pass mixed with the urine. So these are the symptoms. So how to identify that? Whenever person feel painful passage of urine, he must consult the nearest physician and get his or her urine checked. Very common urinary test is there, that is called urine routine and microscopic examination. It is being carried out even if in primary healthcare center level. So whenever the urine routine and microscopic examinations shows the evidence of infection, then the physician will take decision regarding prescription of antibiotics and enhancement of fluid intake. Also, side by side, the other causes of urinary stasis need to be evaluated, and the common causes of urinary tract obstructions need to be identified and treated. So, common causes of urinary tract infections are urinary tract stenosis, synechia of urethra, passage of concentrated urine, then stasis of urine due to bladder neck obstruction like benign prostatic hypertrophy, presence of stone in various parts of the urinary tract due to growth in the urinary tract like tumors also sometimes plays a role in generating stasis of flow of urine. So the presence of pus cell, red blood cell, and large number of epithelial cellular cells, passage of albumin, and deposits in routine examinations are significant findings in case of urinary tract infection. Whenever there is rise in pus cell of urine in microscopic examination should always invites the necessity of urinary culture and sensitivity test. So physician whenever see that the urinary pus cell count in microscopic examination exceeds beyond 5 per half hour field, needs culture and sensitivity test, and based on the culture and sensitivity test, the specific antibiotics are prescribed. But before the culture reports come, presumptive and provisional antibiotics must be started, and after 7 days of antibiotics and antimicrobial therapy, the urine test must be repeated to see the improvement in pathological findings. If a person get recurrent urinary tract infection, then the cause of recurrence must be found out and suitable specific treatment need to be done. So the common antimicrobial drugs which are used in urinary tract infections are nitrofurantoin, sulfonamides like trimethoprim and sulfamethoxazole, and ciprofloxacin, ofloxacin, norfloxacin, levofloxacin, and if the sensitivity pattern is known, then after coming of that culture report, the specific antibiotics like amikacin, then piperacillin tazobactam, Fluoxacillin, amoxicillin may be started. So this is about the treatment, sign and symptoms. Now I will tell some points regarding prevention of urinary tract infection. We need to take following preventive steps so that the impact of this infection doesn't bother us in future. First, take adequate amount of water. It should be at least more than 3.5 to 4 liters for a normal working person. According to the demand and sweat rate, we need to adjust the water intake. Whatever amount of job and in whichever amount of fluid we are taking, it must be correlating our heat exposure level. So in order to generate a healthy urine output of 1.5 liters per day, we need to drink our water. It may range from 3.5 to 6 liters, and if we are exposed to extreme heat and engaged in outdoor activities in summer, then it may goes up to 7 to 8 liters also. So our target must be to pass urine which is straw color. It should not be deep yellow or red. The urine flow should be free and with a good stream, and it must not be painful. If some burning sensation or deep colored urine is being passed, then we must increase our water intake. Second, we should not hold our urine when the urge comes. It must be immediately passed, because the commensal organism of urinary tract sometimes get pathogenic when they get a chance of stasis. When our urine is accumulated for prolonged period in bladder, then there is a normal tendency of multiplication of the bacteria. In natural course of our life, they should not have produced infection. The third thing, if any urinary tract obstruction related illnesses like stricture of urethra or some bladder neck obstruction like benign hypertrophy of prostate, or any tumor like things, or any intervention of urinary tract like catheterization is done, then we need to consult our doctor frequently to prevent the infection. Fourth, the persons who are living their life with indwelling catheter, they must take antibiotics once the catheter is changed, because catheter is a foreign body, and the presence of foreign body in urinary tract attracts infective organisms and it leads to infection. So these are some common precautions we can take in our day-to-day life to prevent urinary tract infection. Thank you.